Welcome back. In today's video, I want to discuss three important aspects of vitamin D and how crucial I believe this overlooked vitamin can really help boost the immune system, improve it, support the function. Let's get into today's content. Okay, the overview of vitamin D. We're going to be discussing for the next 4 to 5 minutes here the physical barrier improvement with vitamin D, cellular natural immunity, and adaptive immunity. So let's get into each one of these topics. First, physical barrier. Vitamin D enhances physical barriers, maintains tight junctions. What are those? Tight junctions are located within the body's epithelium and endothelial cells. Epithelial cells are the cells covering the body's internal and external surfaces, where endothelial, endo meaning internal, are, as it says, cells lining internal surfaces of the circulatory system. Vitamin D also maintains gap junctions. Gap junctions are what permits direct cell-to-cell transmission of ions and other small molecules. So again, vitamin D is helping to maintain this cell-to-cell communication and improving, in my opinion, the overall communication back and forth. If there is some type of viral intruder or bacteria, what have you, vitamin D can essentially come in and help with communication. So think of vitamin D as enhancing communication between cells, tissues, and so forth. And vitamin D maintains adherens junctions. Adherens junctions assist in the formation of tight junctions. So again, I think of vitamin D as just overall communication, and by that I mean the physical improvement of our barrier system in our body. Vitamin D enhances cellular immunity. So what does this do? It reduces the cytokine storm via the innate immune system. So we'll talk about adaptive immune system in just a moment, but the innate immune system is that where it's really the immune system that we're born with. It's rather non-specific is the easiest way that I can describe it. Vitamin D attenuates or lessens the pro-inflammatory Th1 cytokines. So not that the Th1 cells are, we need them, but sometimes they can become overactivated, and this is often seen in autoimmune issues. So vitamin D can, again, dampen down the excitement of these Th1 pro-inflammatory cytokines. What are those? Well, essentially TNF alpha, as it says here, and interferon gamma. The third benefit of vitamin D in improving the immune system is the adaptive immune system. So this is where the immune system is bringing in information, learning from it, and then doing something with that information, changing the immune system, building out specific antibodies through B cells, which are directed through T cells, on how to combat very specific antigens, pieces of virus protein and so forth, bacteria protein. So vitamin D has repressive effects towards inflammatory cytokines that have gone out a little bit out of control. So it downregulates IL-2 and interferon gamma through the modulation of these T helper cells 1, Th1 cells. Vitamin D also promotes cytokine influencers of Th2 cells. So this in turn helps to again calm down or turn down this overexcitement of Th1 cells. And then vitamin D also influences T regulatory cells or Treg cells through the inhibition of the inflammatory process. So keep all of this in mind. So barrier enhancement, innate immune system modulation, and adaptive immune system modulation. So why focus on vitamin D? Well, less time is spent outside, especially in the winter. Right now we're towards the end of January here in Wisconsin. We're not getting the sunlight that we should be and making our own vitamin D through our skin. Blood levels decline with age. This has been shown in multitude of different studies and research articles that as we age, we just have this lessened ability to produce vitamin D. And with COVID-19, fatality rates increase with age. So again, we got to look at the aging population that's staying inside, not getting sunlight, that are more susceptible to viral and bacterial infections overall. And so we should be monitoring, in my opinion, their vitamin D levels and supplementing as appropriate. And another reason to focus on vitamin D, various pharmaceutical drugs can reduce vitamin D levels. Even if we are supplementing with vitamin D, there are a list of pharmaceuticals. Check with your provider, your pharmacist, your doctor, and they can work with you on, again, possible, not that we would change the medication per se, but that we would increase the dose of vitamin D supplementation. What else do we need to know about vitamin D? Well, here it is. Vitamin D increases the expression of glutathione gene synthesis. Why do we care about this? Glutathione is a very strong antioxidant, and if we can improve glutathione production in the body, that in turn can, in theory, leave us with more vitamin C, which has been known to have antiviral properties to it. So increasing the body's own production of another antioxidant, being glutathione, will leave us with more of a reserve of vitamin C to go help fight different infections. Vitamin D activation is dependent upon magnesium. I cannot stress this enough. Sometimes we supplement with vitamin D and we think all is well and good, when in fact that patient might be severely magnesium depleted. The best way, in my opinion, to look at magnesium levels is not through the typical magnesium serum blood test, but something called the RBC magnesium blood test. I know this is available through LabCorp. My point is this, is make sure we're getting a tissue level that is in the appropriate normal level for your magnesium. Work with your provider on consideration for supplementation in magnesium. And then vitamin D enhances calcium absorption. We know this, but my point is when we're increasing calcium absorption with the addition of vitamin D, this does lead to a potential problem as we can get over-calcification of our arteries, and that's going to potentially lead to atherosclerosis. And now we've got another problem. We're trying to fix one thing on one hand, and then we are increasing our risk of another problem on the other. What can we do about that? Again, work with your provider on supplementation with vitamin K2. Why is this important? Vitamin K2 can take that added calcium that has been drawn in from vitamin D and deposit that into our bone tissue instead of the arterial walls of our blood vessels. So that is something critically important to take home. Here is an article that talks about the role of magnesium and how it is assisting in the activation of vitamin D. I'll let you read that on your own. And this is something that I think has been overlooked, at least in my opinion. There are still many patients coming through the pharmacy door that really think of vitamin D as something I need to take to build bone tissue. My doctor came in and said I'm osteoporotic, or I have osteoporosis, and really think of vitamin D. Yes, it helps with bone tissue by pulling in more calcium, but think of it also as improving the immune system. This was a study that was done. It was patients that were selected from 2011 through 2014. This was a double-blind, randomized controlled trial that looked at high-dose vitamin D in the hospital setting and had significant benefits to those patients that were critically ill. So I encourage you to, again, there's the reference there, to look at that article as well. We've been getting questions on how to order supplementation through our pharmacy. We are licensed in Wisconsin, Illinois, and Michigan. With supplementation, we can ship this all over the country. So if you're interested in working with one of our pharmacists, I encourage you to call the pharmacy. This is our website here. If you want to order supplementation, here is the website link on the page, and you fill out the order form. And in this box below here, on the second part, it says please include the names and the number of bottles for shipment. And For those watching this via YouTube, I will put a promo code here, YouTube 2024. We will offer you a 20% discount on any supplements that are ordered. You just have to put the name of the product you want, the number of bottles, and the bottle size. If you do not know that, I encourage you to give the pharmacy a call, and we can certainly walk you through that. So again, that promo code, YouTube 2024, that'll be honored through the end of February. So those of you that are watching online, you can have an added benefit of a little more of a discount. In next week's video, I will be discussing the glycocalyx, the endothelial glycocalyx. These are little hair-like projections that are on the inside of our blood vessels, and the COVID-19 virus has been proposed to essentially break down these very fragile peptides on the inside of the endothelial lining of our blood vessels that, again, potentially can create a lot of issues with vasoconstriction because these peptides are responsible or partially responsible for producing nitric oxide, which in turn helps with vasodilation and proper blood pressure control. So stay tuned next week. Thanks for tuning in, and we will see you on the next video.